Ladies and gentlemen, Dr. Timothy McKnight.
Welcome, everybody. It's good to know you're on the other end of this laptop. I was watching who was checking in, so I'm happy to see a lot of you that I know, and I've been looking forward to having you be part of this series. So again, thanks for joining this, and I hope you have a wonderful experience with this. As you know, we're doing this a little bit differently this time. This is our second virtual series of classes, and having these classes available to you a few days in advance is different. So we hope it will be more convenient to break the lectures up, and we want to use the live lectures as just a chance to quickly review some of the key points of each lecture, and without being too repetitive, but then give you a chance to ask questions and have some interaction. So I'm hoping that most of you were able to watch all three segments of the first lecture, and if not all three, at least two of them. But it's really important, I think, that you watch these and hear what's presented, because a lot of times the content of these classes builds upon itself and transfers into the next lecture. So you should all have at your disposal a student manual and the companion journal. So these two kind of go hand in hand, and we'll ask you to do assignments each week that are not intended to require a lot of your time, but they are intended to help you reflect and to learn things through the reflections that will help you as you go forward. So let me, in 10 minutes, try to highlight some of the key points that I was trying to make in the first lecture. So this lecture is entitled The Wellness Crisis, and basically we're setting the stage to help you understand that we are so used to disease in our current year and the time that we live, that we're sometimes almost immune to the fact that many of us are very sick, and we just expect this is what life is supposed to be like. So the first point that I made was, we talked in the series earlier, was we talked about what kills us. And this is a slide from the CDC. And the point here is that heart disease and cancer are by far the most common. And half of us will die of one of these two diseases. And the question is, can we accept that? Should that happen? And the answer is absolutely not. Those are still very dangerous conditions, and they lead to a lot of mortality. But the point I'm trying to make through this lecture is that we should not be victims of these two diseases at the rates that we're seeing. Then I showed another slide, which is an older slide, but it brings to bear the fact that medical care, at least 18 years ago, was the third leading cause of death. And I'm sure that's not the third leading cause of death now. This is, as I mentioned, is very hard data to find in the literature, because not many physicians are going to report when they do a death certificate that it was medical care was the cause of death. And these statistics from the National Vital Statistics reports come from death certificates. So it's hard to find this. When those numbers were broken down in this previous study, we saw that almost half of all of these deaths are due to adverse drug effects, so too many medications. All of these other causes of death in healthcare have markedly decreased because of the efforts that we've taken as a result of these findings to make sure that we're much more careful about what we do with patients in the hospital. But the adverse drug effects continue to be a problem, continue to be a concern, and many of you who are taking 5 or 6 or 7 or 8 or 9 medications probably aren't comfortable with it, and there's a lot of potential side effects and drug interactions that many of us simply are not aware of. This is a great point that tells us that these chronic diseases, diabetes, heart disease, cancer, colon cancer, and stroke, are highly, highly preventable, avoidable with a healthy lifestyle. So we cannot accept that 91% of we cannot accept that diabetes just happens when we gain weight. 91% of the time it's preventable. Heart disease, 82% of the time it's preventable. The leading cause of death in the United States is preventable 82% of the time with a healthy lifestyle. Then the second point was we reviewed briefly some of these key diseases that seem to be growing in epidemic proportions. So we talked about heart disease and the fact that we do 500,000 bypass surgeries a year. And the very word itself, bypass, means that we're circumventing the blockage, but we're not asking why did they have the blockage to begin with and how can we stop those blockages from progressing. So again, there's a 2.5% chance of dying during the surgery. And the question is, are these acceptable numbers and rates for managing a disease? We're not fixing the disease, we're bypassing the problem temporarily. We talked about how these are done, how these procedures are done, the open heart surgery, and where we get the veins to use as arteries in a heart. And again, those veins are not natural. They're not meant to serve and work as arteries. And so many times these veins that we use to graft past those narrow obstructions in a coronary artery, they themselves plug up. And this study was telling us that when we do the endoscopic technique, which is a little nick in the leg and we tease out the vein, that within a year and a half, 47% of these occlude. And when we do the vein graft technique, which is what we're showing you the image of, 38% of the time, these grafts will plug up with clot and not be able to carry blood. And in my mother's case, a 3-way bypass, within 4 weeks, one of those bypass grafts had occluded and was non-functional. So these are fairly high failure rates that, again, we need to think about why is that happening and is there a better way? Well, probably the better way to bypass, to restore blood flow, if we can do it, are the stents. But 61 clinical studies with over 25,000 patients showed that even putting these stents in does not necessarily lead to fewer deaths. It allows us to live symptom-free for longer. But as you should be able to see, if we balloon and open up one narrow lesion in an artery in your heart, and you haven't changed your lifestyle, you're going to develop more plaque and need something potentially down the road. So we do 1 million of these a year. They're invasive, but they're pretty low risk, but they're not risk-free. 40,000 people a year have a heart attack during this procedure, and 10,000 people die during this procedure. There are several reasons for this, but remember, these are humans, and humans sometimes make mistakes, and sometimes we're pushing a catheter wire in an area that we shouldn't be pushing it too hard, and we end up tearing the artery or causing an aneurysm in the artery, and someone dies in the cath lab because somebody's trying to make their numbers to do something that other cardiologists maybe couldn't achieve. So there's human error, and there's just the fact that sometimes bad things happen in procedures. We talked about the leading causes of cancer that kill. So lung cancer is the most common cancer with the highest mortality rate. And then you can see this list. But I mentioned in the previous lecture that 4 out of 10 of these cancers align the intestinal tract. And I ask if food might be a contributor to this. And my answer to this is absolutely. Why wouldn't food be a contributor to some of these cancers, as toxins and pesticides and other cancer-forming agents react against in the walls of these particular tissues. Your odds of cancer are close to 50%. Men, 45% risk of developing cancer. Women, 38% risk of cancer. Your risk of dying from cancer is about 1 out of 5. So these are not the greatest odds. Those aren't the odds any of us want to live with. Then we moved over to the body mass index, and this is actually in your workbook. You can find this chart in the first couple pages of the first chapter, and you can look at your height and weight and find out what your body mass index is, and you'll probably be very disappointed, very depressed, very upset to find that you're heavier or in a category you didn't think you should be in. And then I walked you through how we become more obese since we started tracking this in 1985. And the point is this is escalating. We're getting heavier and heavier with each passing year. And we're predicting to have 42% of Americans in the obese category by the year 2030. And at the rate we're going, we'll probably be there by 2025. These are some of the complications of obesity. This shouldn't surprise anybody. But some of these may be a little surprising, or something conditions that you didn't realize are related to obesity. So if you lose this weight and you approach a normal body weight, many of these disease states can either be reversed or much more easily controlled. These are some of the hormonal or abnormalities of obesity. We're going to talk about hormones quite a bit in week 11, but I wanted to set the stage. Cortisol is a stress hormone. So if you have chronic stress and you have chronic cortisol production, think of cortisol as a cousin to prednisone. We wouldn't want any of you to take prednisone long term, but chronic stress has a similar effect, and it will make you gain weight. High insulin resistance from eating too many carbs is the primary reason for any of us to be overweight or obese. Insulin levels cause you to make fat. High insulin levels, it just turns on the fat-making machinery. It turns up a hormone called leptin, which normally, when you secrete, normally leptin's role is to help decrease your appetite. But when leptin is missignaled, you won't feel full. You go back for seconds or thirds. And ghrelin is the hormone that says, I'm hungry, it's time to eat. Well, if you become more obese and more insulin resistant, that message that signals even stronger and stronger, leading us to overeat. Sex hormone binding globulin is a protein that women can have problems with. It's a sign of inflammation, and it can cause increased hair growth in women. Progesterone levels drop in obese women, and that makes them more likely to be irritable, anxious, and have poor sleep. We talked about the fact that when women go into menopause and they stop making estrogen, this is the primary reason why women gain weight in their 40s and 50s. It has nothing to do with their exercise, nothing to do with their diet changing. It's the fact that their ovaries shut off with less estrogen. There's a gain of weight around the belly. So we can't be telling these women, you got to eat better, you got to exercise more. Well, almost all of us could improve both of those, but their primary issue is a lack of estrogen, and that has to be addressed. Otherwise, they will have difficulty achieving their ideal body weight. If they continue to gain this weight at menopause, then they increase their risk for diabetes and heart disease. When you develop more fat cells and you become obese after menopause, it increases a bad estrogen called estrone, and this is the estrogen linked to breast cancer. It's not estradiol. It's not the estrogen that allows you to ovulate and keeps your skin soft and smooth and your bones strong, your heart healthy. It's a completely different molecule. This estrone is more prevalent in obese individuals. Men, if you develop a big gut, you're going to have a drop in testosterone. That big gut, that fat gut, that beer belly is very inflammatory, and it will cause you to gain weight, and it will increase your risk for diabetes. It will increase your bad cholesterol and increase your risk for heart disease. If we castrated you at 20 and took away your testosterone, not only would you be depressed and have no drive for anything of physical activity, but we would significantly increase and accelerate your risk of heart disease. So the corollary is true. High testosterone levels into the later years is also very protective to the heart if you can maintain an ideal body weight. And I was pointing out that testosterone levels have dropped significantly in the last 10 years. Growth hormone production declines with obesity. We all should have optimal growth hormone. You can initiate and stimulate growth hormone production by adequate sleep and by good strenuous exercise, particularly strength training. And then obesity will kill nitric oxide production. Nitric oxide is the key chemical that makes your blood vessels dilate, that helps you when you're exercising to get blood flow to your heart. But it also, in men, it helps to provide blood flow to the genitals to allow them to have and to maintain an erection. So low nitric oxide levels put you at increased risk for not only erectile dysfunction, but heart disease. And there may be some correlation with this issue of declining nitric oxide with women who are not able to be stimulated during sexual intercourse. And other causes, again, the primary cause of obesity is high carb diet. If you want to lose weight, women, you got to get your estrogen balanced, but all of us need to reduce our carbohydrate intake, probably down to 50 grams a day or less. If you don't do that, you're never going to get to that ideal body weight. And that's the hardest thing to do, but we're going to talk about that over the next few weeks. We also know that by steroid hormone imbalance, as I mentioned, low estrogen, low testosterone, low thyroid hormone, we'll talk about that. Stress, I mentioned that, sleep deprivation, loss of muscle mass. We're all going to lose muscle mass as we get older, but if we stay active and we train correctly, we can maintain that muscle mass, and muscle is the best tissue for burning fat. The more muscle you have, the more fat you'll be able to burn. Staying active is how we increase our metabolism, and we'll explain that as we get into the cardiovascular fitness. Gut dysfunction, an unhealthy gut, a gut where you have inflammation, gas, bloating, diarrhea, lots of problems, is a sign of a gut that's not balanced with a healthy bacteria, and that also has an association with obesity. And then obese thoughts, emotions, and behaviors. All of these things have to be considered when you're trying to figure out why is it so difficult to lose weight. Which one of these are the biggest contributors to my weight gain, and also which one of these are the biggest solutions to help me get that weight off. We talked about the reward center in the brain, and you should see by looking at this, as I mentioned, that high dopamine levels, which are red, are a sign of pleasure and interest. And you can see the only person in these four categories that really can feel that is a normal brain. The brain of an obese person does not make much dopamine. So how do they feel better? They get the chemical reward from the food, and primarily it's either salty foods or sugary foods, sweet foods. So we're all just trying to feel good. And so when someone is morbidly obese and they're eating candy bars and drinking pop, they're not doing it because they have no self-control. They're doing it because they're trying to feel like the rest of us feel when our weight is normal. We talked about our genes, and I mentioned that humans have very few genes in relation to all other living species on the planet. So how can we be so sophisticated? Because sometimes we want to blame our genes on our obesity, blame our genes on our heart disease or our risk for cancer. Well, there may be times when there's somewhat of a connection and association, but our genes do not dictate our future physiology. What dictates it is the epigenetics, the environment that we put ourselves in. And all these environmental contributors can make us more susceptible to heart disease, to cancer, to osteoarthritis, and all these chronic diseases we're struggling with. So we are all of these things. We are what we eat, but we got to be able to digest it and absorb it. We are what we breathe. We are what we put on our skin. And we have to eliminate bad things. And our elimination routes are sweating, urination, breathing, and bowel movements. These all have to be healthy. Our liver has to be healthy to help us get rid of these toxins. But we are also a combination of the quality of our thoughts, our emotional states, the people in our lives, and the messages we hear from these people, and how we feel about ourselves because of these people. So all these energies contribute to our overall health. So we don't want to overlook any one of these. All of these have to be addressed. Maybe your struggle has nothing to do with your diet, nothing to do with exercise, nothing to do with genetics. Maybe it has to do with a toxic relationship that has just beat you down year after year after year. And until you fix that, you either leave that toxic relationship or you find a way to heal from that toxic relationship. You're going to struggle with doing all the other things that will help you heal. This is the diabetes and the obesity map overlaid on top of each other. And you can see how both of these increase in parallel rates and prevalence. And this ended in 2015. So I checked and I did the 2020 numbers. So more than 40% of Americans are now obese by this definition, and more than 9.5% of Americans have type 2 diabetes. So The question then becomes, where do you expect this trend to be in 5 years, in 10 years? Is there any evidence that we're going to get a handle on it? We're going to improve it? And the answer is not with the approach that we have. If we don't do something drastic, if we don't do something comprehensive, if we don't get in touch with all of our behaviors that drive us this direction and understand the foods that cause this to happen and the thoughts and the emotions and our exercise patterns, if we don't do something about this, it's going to continue to be a problem. And think about the economic repercussions. We also talked about metabolic syndrome, which is this visceral fat, this fat that lives right inside on top of our intestines, that this is a prevalent problem, equal in men and women. And you can see from this graph, this shows you the biochemical connections that just having belly fat causes. It causes your good testosterone to convert to this bad estrogen that increases your risk for breast, ovarian, uterine, and prostate cancer, and possibly colon and pancreatic cancer. If you want to reduce your risk of these cancers, you got to get rid of that belly fat. You've got to get rid of that big gut. Visceral fat will increase insulin resistance and make you more likely to develop diabetes. If you have a big gut and you have diabetes in your family, you're almost guaranteed to become diabetic if you gain too much weight around your belly. Visceral fat will also reduce your good cholesterol, the HDL, and increase the bad LDL cholesterol. It will lead to gallstones. It will lead to hypertension. So this is a tremendous price to pay for gaining 20, 30, or 40, or 50 pounds around your belly. So the question is, can you reverse metabolic syndrome and your propensity for these diseases if you get down to approach an ideal body weight? And I didn't say become your ideal body weight, but I said approach it. And the answer is absolutely. Now, once you've got gallstones, they're not going away. Some people believe once you have heart disease and atherosclerotic plaque, it's not going away. But there are other clinicians who have evidence that you can reverse heart disease. So I think there's always something that can be done. And it's just a matter of us committing to the lifestyle changes to see what happens. So we're on this projected crash course, right? You've seen now heart disease, cancer, metabolic syndrome, obesity, diabetes. All of these seem to be getting worse, seem to be becoming more prevalent, and no one's got a solution for it. And then I shared with you a story about a patient who I took care of in the hospital, and the fact that she was a victim of this healthcare system. She had a urinary infection that could have been treated with $10 prescription as an outpatient. Instead, we had her in the hospital for 4 days at a cost of $9,000. This is her list of medication, and you can see the price for this. None of these medications are reversing her disease. These medications are trying to manage her disease, but she's not getting healthier. So as much as this is hard for us sometimes as providers, and we get frustrated when we have to care for these kind of people, we really need to be compassionate because she's just trying to survive the environment. She's doing the best she can, and she's a victim of a healthcare system that's failed her. So the next point that I made, the third point, is our crisis response. Hopefully you can see there's a crisis, and the response is pretty pathetic in my opinion. So the allopathic approach, if you just look at the definition for allopathic doctors, MDs and DOs, is the system of a medical practice that aims to combat disease. It didn't say reverse disease, it says fight it by using remedies like drugs and surgery. Well, that's not how we develop the disease. The disease didn't develop because of drugs and surgery. So the solution is a little bit backwards. It's a little bit downstream. So how can we best support our body's inherent ability to heal itself from all these cancerous growths, infections, chronic inflammation, and injuries? That's the question we should be asking. So our external solutions are very external. They're pills. They're spending more money on healthcare. There's these quick fix programs that promise great outcomes with minimal effort on your part. There's the food industry that's trying to assume the responsibility of educating us on a healthy diet, but they're throwing terms around that confuse the consumer and to mislead them in a direction that really isn't going to reverse these diseases. So I showed you the gross domestic product changes. You can see that we're spending more and more every year on healthcare. And the question is, are we getting a return on investment? And I'm going to say, how can we be getting a return on investment when we have half of our population dying from either cancer or heart disease? And that one of those first slides I showed you said 82% of heart disease is preventable. Where's this investment going? Why are we not seeing the return on it? Then we showed you the per capita expenditure of our country compared to other industrialized countries. And we spend more than any other country, but our health is not more. We're not improving our health. Our performance is poor and our overall health is 72nd. And then we talked about the high price of pharmaceuticals. So pharmaceuticals are apparently the answer to these problems. But pharmaceuticals are a business, $1 billion investment to bring a drug to market. Most of these drugs never make it to even the clinical trials. And so there's a clock that ticks when you file a patent for this new chemical. And by the time you've passed phase 3 trials and you're ready to market this to the population, half of the 20-year patent has expired. You got to make up this $1 billion. So you're going to market this. You're going to convince providers that they should use this. You're going to convince the public that they should use these drugs. And again, how many of these pharmaceuticals actually treat or reverse disease? The only class I know of is antibiotics. And sometimes antibiotics are not necessary. But most of the other ones, we're not seeing any disease be reversed. And then we talked about, this disease called depression and all the symptoms that go with it. We talked about the practice of American physicians who we are trained to prescribe medications, and antidepressants are the most commonly prescribed class. Can you see why? I mean, why wouldn't you feel some sense of depression when half of us are dying from miserable deaths from heart disease and cancer? We're getting heavier and heavier and we can't control it. We feel like our life is never going to return to normal when we have all these restrictions on us. What a depressing situation and environment to live in. We also have programs that are promising to help us. And most of these are pretty gimmicky. They might help in the short term, but I don't think most of the time they're addressing the entire person. They're not addressing the quality of thoughts, emotions, and relationships. They're not addressing hormonal imbalances. They're not addressing maybe foods the way they should or exercise the way they should. Many of you have done some of these programs and have injured yourself. This insanity program has fallen out of favor, I think, because so many people got injured on it. We have a lot of people who like CrossFit. CrossFit is a great exercise program where you're competing against yourself. I would never recommend CrossFit, though, because there's so many back injuries and so many musculoskeletal injuries because you're working against the clock. And when you fatigue, you start to compromise your form and get injured. Then we have science, the scientific approach. And I mentioned that there's a lot of gray areas in science. We want it to be black and white. It is not black and white. There's a lot of statistical analysis and assumptions that have to be made with the scientific process. There's a difference between statistical significance and clinical significance. So sometimes I feel these reports and these statistical numbers that we see are more of I'm not going to say a brainwashing, but we're misled when we see these numbers. Statistically significant doesn't mean it's going to change my life. It means the difference we see between the treatment group and the placebo group is not due to random chance, that there is something that accounts for the difference. That's the only conclusion you can make with statistical significance. And then there's the gray areas, as I mentioned. I gave this example of milk. Is it good or is it bad? So this is a slide that I added just as I was thinking about this. So this wasn't on your first set of slides. So hopefully you'll receive those in a PDF form on what I presented on Sunday. But how do you know what to believe? How do you decide for the truth? Well, where are the credible sources of information? Is it science? Well, often science is credible, but is it always credible? I've seen plenty of drugs taken off the market after they pass phase 3 trials. What about those of you who have religious convictions or believe in God? Is that your source of deciphering the truth? What about your own observations or experiences? Or those become very strong emotional ties and hard to persuade you to believe otherwise when you were raised that carrots make your eyes, really good because your mother told you so. That's confirmational bias. Nobody's going to tell you otherwise because mom was right. She knows what's right. And then we have all of these authorities. When it comes to diseases, when it comes to the COVID vaccine, who are you going to listen to? Are you going to listen to the CDC, the FDA, the World Health Organization? Are these credible, reliable sources? Or do you find holes in some of these recommendations? Do you find inconsistencies? This is something I think we're all struggling with. And I can tell you as a provider, I'm struggling with this as well. So I haven't, my old paradigm in helping me decipher where the truth is, or the relative truth, was a combination of what I was taught in science and in medical school, and then my religious convictions. Now, some of you, the religious convictions are not a factor, but many of you who believe in God and have a religious background, you will follow those convictions and you will make everything else work based on that, because to go against your religious convictions is difficult to admit that you would do that. So for me, for quite a while, I had to make sure that what I believed from a religious standpoint, a spiritual standpoint, didn't conflict with science. And if it did conflict with science, the assumption was science was wrong and this will be disproven. So that model worked for me for a while. But as I've aged and I've seen more, I've changed this paradigm. So my new paradigm is, what does nature teach? I think nature has it right. We need to study nature. Now, this is a little bit more inclusive because some of you, we just study how a tree grows, how water flows. We can study what happens with the earth in a 24-hour rotation. What does that teach us about healing and balance and all those messages that nature teaches? But this also gives you room to put your religious convictions in. So nature teaches us how to live. And if you believe in God, then God is nature's creator. And this is sort of God's handiwork that's saying, I'm gonna give you some clues here. I'm gonna give you some hints on where you can find the truth and what to look for. My next level of deciphering truth is, what does known physiology and biochemistry teach? These are well-established sciences. So we know that certain things will happen with a cell membrane conduction with the sodium and potassium channels. It's reproducible over and over again. We know that's just going to be reliable every time. What does biochemistry teach? To me, that has to also be consistent with the first layer. And then what do the research trends support? One research study does not support a trend or a body of evidence. If the body of evidence says this is what we see, then maybe we should pay attention to that. But to me, it's not going to trump the message from nature. And then what does common sense say? Sometimes you just have to sit back and say, what makes sense here? I've studied this out. Does this make sense? And then at the very end is, what is the latest study, or what does the latest expert say? One study is not going to overturn a trend of studies. One study will catch our attention, or at least catch my attention, and make me say, is there a flaw with this? Is this valid? Are we going to be able to reproduce this? It just gets my attention, but I'm not going to shift my paradigm and how I interpret what I see in the world and what I believe the truth to be by one study or one expert telling us their interpretation of what the truth is. So I ask you to do some reflections. Hopefully you did those reflections in the workbook. I think it's crucial that you do those each time we have a presentation, because this is where you're going to get a lot of insight. This is where a lot of learning will come. So the assignments that I gave you this week, from a nutritional standpoint, there were no assignments. If you want to start healing, you want to start losing weight and getting healthier, then I suggest that you look at the journal on page 97 through 104, where there's some summaries on weight loss do's and don'ts. There's a list of foods that are very narrow in scope, but I would tell you, start with these foods. There's some information on fasting, but none of you I'm committing or asking you to commit to do anything different from a nutritional standpoint. I do want you to start moving a little bit more. 3 days a week is the key here. How long you do and what you do is not important to me. It's that you start someplace and you slowly build from there. And then again, reading the behavior aspect of each chapter, which is the self-discovery challenge in this week's lecture, is where you're going to start learning behavior modification. And that starts on page 5. And it's only 2 or 3 pages. And that's intended for you to read and reflect and jot down the questions that are posed in those 3 pages. So next week, we're going to talk about mindfulness, and we're going to talk about, are you ready to change, and help you understand perception and reality. This is going to set the stage for helping you really understand how to change your behavior, because we're going to help you understand how you develop the behavior patterns that you have. And then the following week, we're going to help you rewire your brain to change those behaviors. I think if we skip this, we're going to do ourselves a disservice. We can't just jump into tell me what to eat, because as soon as you do that, you're going to sabotage yourself on a Friday night and be with your friends and have a pizza and a glass of Coke, and you're going to be doing things that you shouldn't do. So we really have to understand the power of our mind as it relates to behaviors before we jump into that in week 4. So that's the summary I have for tonight. Kelly's standing by with hopefully some questions. So we'll have a little interaction here, and we'll see if we can help answer some of the questions you've got.
More than one can ask this question of your feelings on the COVID-19 vaccine.
See, that goes back to truth. That's why I added that slide, because that's been on my mind, and that a lot of people have asked me that question. Last weekend, I watched an hour-long video by a pretty well-known doctor on Facebook, and he was interviewing a virologist at CDC, someone who's actively involved in following these studies with the COVID vaccine and just assimilating the information that we know. The argument was pretty persuasive that we should all get vaccinated, that no one would be accepted or excluded from that recommendation. It left me a little bit confused. Then I watched a video from a doctor on Frontline Doctors who made it also a very convincing statement or explanation, how that we should not jump right into this. We should give it a little bit of time. There's some questions that arise with the safety of the vaccine, the efficacy, the long-term potential side effects. And so I'm hearing 2 experts in my mind say the polar opposite. So how do you decipher this? That's why I put that slide up. You've got to decide how you're going to decipher what you hear and how you interpret what the truth is. So for me, the conclusion that I've made at this point is I'm going to wait 3 months, and I'm going to see how people do with this, what kind of side effects, what kind of problems there are, and just give it a little bit more time before I jump into it. But I've been pretty opposed to it up until now, and I'm starting to rethink that. But again, you've got to figure out what your hierarchy is. If my religious leaders are starting to get the vaccine, that might stimulate me to go ahead and trust them because of who I believe they are to potentially get the vaccine. But it's a real struggle that we all have, and I think you need to set up your own hierarchy of how you're going to decipher the truth from all the voices that are out there. I think you need to go to a quiet place to reflect and to really feel and think about what's best for you. So I'm not going to tell you what's best for you because I don't know. I think you have to be comfortable with it, but that would be my answer to your question.
Okay. One participant asks, I'm very interested in the use of progesterone and estrogen for menopause. How do I get started if my GYN does not want to do this? How do I deal with the hot flashes?
That's a great question. So if you are in this area and would be willing to come and see me, I'm more than happy to help you with it. You have to let them know that you're a Fit for Life participant who I promised that I would take care of. If you're out of the area or in an area where it used to be too hard to come here, my recommendation is that you go to WorldLink, that's WorldLink, all one word, I think it's WorldLink.org, maybe it's .com. Try either one of those, WorldLink.com or org. And this is the organization that trains physicians the right way, the safe way, the effective way to do hormone replacement therapy. And if you go to this website, this is where they get their training, but you can you can go on the menu and find an area that says find a doctor near me, and then you type in a doctor within a 150-mile radius, and it'll give you a list of doctors who have been through this training and have been certified in this training, and you'll know you're getting a very, very high quality practitioner who do this extremely safely and very effectively.
Does Dr. McKnight believe in diet?
I don't believe that you have to follow a vegan diet. I think a vegan diet is extremely healthy. So if that's what you want to do, I would say do it, because you're going to get lots of good nutrition if you do that. But most of us aren't ready to give up some animal protein. We'll talk a lot about animal protein in a couple of weeks. I think we eat too much animal protein. So I'm not opposed to a vegan diet, but I don't necessarily think you have to all follow the vegan diet.
The next question is, how do we focus on an unhealthy gut? And how often should we empty our gut?
The frequency of bowel movements has nothing to do with the quality of your gut. The quality of your gut health has to do with soft bowel movements that pass easily. With little effort, you have a healthy bowel movement. As far as balancing the gut, we'll talk a little bit about that in coming weeks. But you want to avoid things that injure the gut, like antibiotics. If you take antibiotics, you need probiotics to restore those healthy bacteria. There's a lot of medications that can disrupt the gut. So, but the best way to heal the gut is by a plant-based diet. And we're going to talk about vegetables. We're going to talk about fruits, nuts, and seeds and beans. So the foods that nature intended us to eat, primarily raw when we can eat them, is the best way to heal your gut.
Do you believe that probiotic supplements for a healthy digestive system is a good idea?
I do believe in probiotic supplements, but I don't necessarily think you need to take a probiotic every day the rest of your life. You need to think of your gut as this lush garden with plants and flowers and shrubs and grasses and beautiful trees. And you don't want the weeds to grow, but you don't want all of one type of flower to grow either. It takes away the beauty of the garden. So if you have a bloated gut, if you have diarrhea, constipation, there's a problem. There's an imbalance of the vegetation in that garden, or the bacteria in your gut. So I would take a probiotic. I'd recommend a refrigerated probiotic that you have to ask the pharmacist for. These are higher quality. I get a bottle and I would take it until it's gone. I take 1 capsule a day. Then I might try a different brand when that's over, but I would only take it for 3 or 4 months. And I would focus on eating healthy foods, because healthy foods are going to be the fertilizer for this garden, and it'll put that garden back into balance.
Another question, do you take probiotics at the same time as antibiotics, or do they cancel each other out?
They somewhat cancel each other out. So if you have to take an antibiotic twice a day, I would take the probiotic in between. I take the probiotic twice a day in between the dosing of that antibiotic, and I would take it until it's gone. So you might be on the antibiotic for 10 to 14 days, but take the probiotic until the bottle's gone. So that might be for a month.
That's the last question I see.
Okay, so that's the last question. Appreciate you all being on. We really welcome your feedback. Please use the Facebook forum as a way to make comments to us and to each other. Kelly and I will try to give you short little video segments as the week go on of information and encouragement. We want to stay connected the best we can. I can't see anybody. I'm hoping you're all still there, and I'm really appreciative that you signed on tonight. So have a great week. I will be working on our next presentation, week 2. We'll have that available to you on Sunday morning like we did the first one. So have a great week until we see you next time.